Kowalski here with Bay Bariatrics. We've got a series of videos answering common patient questions, and one of the common questions we get is, how do you choose the correct surgery? What's the right surgery for me? It's a complicated decision, actually. Right now, we have 3, about to be 4, different surgical options for patients. There's a sleeve gastrectomy, there's a traditional gastric bypass, there's something called the mini gastric bypass, and there's another thing called a duodenal switch. All these options are great for weight loss. All of them have different advantages and disadvantages. Some of the big factors to consider are, how much do I weigh now? What is my current BMI? What do I want to weigh when this is all done? When I reach my new healthier weight, what does that look like? What is that number? And then there's other things to consider as well. Do I have chronic heartburn or reflux problems? Have I had prior abdominal surgeries that may have left me with scar tissue that changes my anatomy? Do I have a hiatal hernia? You don't have to answer any of these questions. That's my job. But if you come and have a consult at Bay Bariatrics, we'll talk together and figure out which one of these great operations fits your goals. In general, the more of the intestine we bypass, the more people need to be careful about supplementing their nutrition so they don't get deficiencies in certain vitamins. But the more weight loss you get. The converse side is, the more complicated the operation, the more things that can go wrong. The truth is that these operations are super safe. Complication rates are extremely low. Serious complications are less than 1%. That being said, we shoot for 100% of our patients not to have complications, and so picking the right operation for the right patient, not making it overly complicated when it doesn't need to be, is definitely the way to go. Our most popular option is sleeve gastrectomy. That is the most popular operation nationally, and I think it's a great option. However, I think it's overused. A lot of patients have problems with reflux that are not adequately addressed by a sleeve gastrectomy, and many patients need a gastric bypass. There are many bariatric practices out there where you won't get a balanced approach, and people are going to say that the cookie cutter, the sleeve gastrectomy is the only and best way to do it. It's just not true. There is variety out there, and you should find a surgeon who does that whole variety and can tailor the operation to you.